Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week's episode was all about healthy habits and where you can start if you don't know where to start. So go back and listen to that episode if you've missed it. This week, we're going to talk all about our sex hormones, exactly which ones are at play in our reproductive cycle and what they are and what we can really just more education around them and how they influence our menstrual cycle. So first we'll start talking about estrogen. We have multiple forms of estrogen, but we have three common forms. We have estrone, which I'll refer to as E1. We have estradiol, which is E2. And we have estriol, which is E3. Estriol is really the third primary estrogen, and it's really only elevated during pregnancy. This form of estrogen is produced by our placenta. So in office, I typically don't test estriol because it is really only elevated during pregnancy. And since I'm not a fertility specialist, I don't really find the need to test it. However, it is used in our hormone replacement therapy for my menopausal patients as part of the bioidentical estrogen therapy replacement. So we do use that in BHRT. Now, estrone, or E1, is our more inflammatory estrogen. And the reason it's inflammatory and why I like to keep this one as minimal as possible or as low as possible is because it has various metabolites. And there's three different metabolites that estrone has. And metabolites are what is excreted through our urine. Two of these three metabolites are more prone to causing breast or endometrial cancer. So we want to keep estrone as minimal as possible. And estradiol and estriol can convert to estrone. So if you've ever run a Dutch test or heard of the Dutch test or dried urine test for comprehensive hormones, this is a really effective way at measuring our estrone metabolites. And I ran this test on myself a while back because of my past cancer history. I wanted to see which of those three metabolite pathways I was preferring, because there's the 2-OH, the 4-OH, and the 16-OH pathway. And the 2-OH pathway is the most preferred and more protective, whereas the 4 and the 16 are the ones that can go the wrong way, which we don't want. So that's estrone. And then we have estradiol, or E2, which is our most abundant and most potent estrogen. And this one is really the one that's made primarily by our ovaries. And so when we reach menopause, estradiol becomes obsolete. It's usually in the toilet. But we can still have these other two hormones, the estrone and or the estriol, if we're on hormone replacement therapy. Estradiol's main function is egg maturation, egg releasing, and it helps the uterine lining growth of the uterine lining. So it's a very, very, very important estrogen. Now, estrogen sometimes gets a bad rap because a lot of women are scared about estrogen because of its cancer-causing side effects, which can be possible, but that's where we monitor the estrogen. That's where we test it and see where your levels are at and make sure that they're in good ratios, and why I'm such a stickler for timing women with their menstrual cycle, because our hormones, specifically estrogen, are all over the place throughout the 28 days. So to get good looks at those hormones, I recommend getting your labs tested on the last half of your cycle, or the luteal phase, days 19, 20, or 21 of your cycle, to see where your estrogen is in relationship with progesterone, which is our next hormone. Progesterone I like to name the queen. Literally, it's the queen of hormones, but really only in its natural state, not the synthetic form of progesterone, which is progestin. And I had a podcast episode, let me find it, 31, back in January, all about progesterone and progestin, the difference between the two. And progestin, just to recap, is the synthetic progesterone found in oral contraception and IUDs. And this one actually can worsen our mood. It can increase our risk of breast cancer and among other cancers. So I don't like progestin, and that's a synthetic form, and I don't prescribe progestin. I prescribe compounded progesterone, which is bioidentical. So our natural progesterone is what rises in our luteal phase, and why I test on days 19, 20, or 21 of the cycle, because that's when it's the only time that it's elevated. It is secreted by our corpus luteum, which is made from the mature egg follicle that we release during ovulation. So a good point to remember is we won't have any progesterone if we're not ovulating. So that's another hormone that tanks during menopause because our ovaries quit. They're done. They're like, I'm out. So no more hormone production, including progesterone. Another really important reproductive hormone is sex hormone binding globulin, or SHBG. And this guy actually carries our hormones around in our blood, but really has a special affinity to testosterone. Sex hormone binding globulin is also found in our liver. So a common thing that I see with women on birth control is a really, really high sex hormone binding globulin, because we're getting all of this synthetic hormone from the pill or the IUD, and our natural hormones like sex hormone binding globulin don't really know what to do. So it starts to build up in the body, and that's where we have to work on liver support to help out the liver in clearing some of this hormone. So when I see a higher sex hormone binding globulin, it likely means that we have a lot of unbound testosterone just waiting to be used. So usually I'll start supporting our detox pathways first before I would throw testosterone at a woman. Another hormone that's in kind of the testosterone realm is DHEA, or dihydroepiandrosterone sulfate. Totally butchered that, and I'm okay with that. Hence why I call it, or why it's labeled DHEA. So this hormone is produced in our adrenal glands, which sit on top of our kidneys, the same place where cortisol is. I know I've talked multiple times about cortisol, our stress hormone. So DHEA helps to make our other hormones in the body, specifically testosterone. So this one can be high or low or optimal. When it's high, I oftentimes see a higher stress response on the body because DHEA is produced by our adrenal glands. Also, it might be pushing the testosterone pathway a little bit more. So that could be the higher androgen. So testosterone might be higher. Very common to see in polycystic ovarian syndrome, or PCOS. Or it might be in the toilet, which it might just be depleted because our adrenals are in the toilet. Or we're in menopause and DHEA is really being used and is a compensatory mechanism. So sometimes we'll supplement with DHEA to push some of those pathways. So that leads us to testosterone. So women need testosterone as much as men do, but not to the extent that men do. Men run off testosterone and cortisol. Those are their primary hormones, whereas women have all of these hormones that are playing a role in our reproductive health. So testosterone is the primary male sex hormone, but like I mentioned, it's essential for women. It's produced in our adrenals and our ovaries. It's helpful for libido, it's helpful for mood, for bone growth, and our muscle mass. So it's super, super important for women. And it's broken down into two different testosterones. We have our total testosterone, which is the total amount that we have, both free and bound. And then we have our free testosterone, which really isn't attached to any other molecules, and it's what is readily available for our cells. So this was the one that supplementing with it or prescribing testosterone, which is a controlled substance, you do need a DEA license to prescribe testosterone, will be helpful in some women. I have had just this last week in practice 2 women that are doing their lab follow-ups, and I've put them on testosterone because they needed it. Everything else was in check. Their DHEA was in check. Their adrenals were good. Their vitamin D levels were good. Everything was good. They were just super testosterone deficient. And now after replacement of it, like libido is back, their energy is back, they feel a lot better. And it really doesn't take a whole lot to really support the female body as far as those diminished levels of testosterone. Prolactin. Prolactin's a hormone that is often not tested, but super, super important. And is really only supposed to be elevated when we're lactating or breastfeeding. Other than that, it should not be elevated. It's made by our pituitary gland, which is in our brain, also where TSH is produced. And like I mentioned, it's responsible for the production of breast milk. When it's low, we can have menstrual irregularities, infertility might happen, puberty might be delayed. And then high, like we might have nipple discharge. It also can inhibit our progesterone production, and that's where we might have, again, the irregular, skipped or missed period. So prolactin plays a giant role in our menstrual health, and I've seen it elevated quite often lately, and it's not normal. So it can definitely play a role in our menstrual health if you're listening and having menstrual irregularities and don't really know the cause. And then the last hormone we'll talk about, besides the thyroid, I'll kind of briefly glance over the thyroid. I have a whole podcast episode on the thyroid, but cortisol. So cortisol is the other hormone produced by our adrenal glands like DHEA. And this is our stress hormone, but it plays a role in our reproductive health because all of these hormones are on the same axis called the HPA axis, the hypothalamus, pituitary, adrenal axis, and they're all connected. So that's where naturopathically and with women's health, like I look at all of this. So if you come to see me as a patient, you know I'm looking at your sex hormones, your adrenal hormones, and your thyroid hormones because it's all connected. So cortisol plays a role. And then thyroid definitely plays a role in our menstrual health as well. So if we have an underactive thyroid, it's going to throw our period off and our menstrual cycle off. And if it's overactive, it might do the same too. We might not have a period. So that's where looking at your lab work will be super helpful at determining where your hormone status is and then how we can correct them. So I hope you learned something from this episode. I don't think I've talked about the hormones specifically and dedicated a whole episode to them. And they're so important to understanding what they are and how they play a role in our menstrual health. So as always, if you found this helpful, I'd appreciate a nice review and share it with the world. And we'll see you all next week.